With U.S. states expected to start receiving the newly approved COVID-19 vaccine on Monday, NewsNation is working to answer your questions about the distribution process. And joining us tonight on NewsNation is Dr. Amesh Adalja, senior scholar at the Johns Hopkins Center for Health Security. Dr. Adalja, thank you so much for joining us tonight.
Thank you for having me.
We know some high-risk Americans could start receiving that first dose of the vaccine within the next few days. But what's a realistic estimate on how long it will take to actually start seeing some widespread impact from the vaccinations?
It's going to take months to see an impact. What we may see initially is when nursing home patients are fully vaccinated, you'll see less pressure on hospitals. Because right now, hospitals are worrying about capacity on a day-to-day basis. When we'll see a major impact on transmission in the community, that's an open question. It's likely going to depend on how well the general population vaccine uptake is. And that's probably not going to be something we see until maybe spring of 2021, because it's a long process where we have different priority groups in the general population where there is spread and a lot of good contribution to community prevalence. They're not going to be able to get the vaccine for some period of time.
Now, we know the CDC's Committee of Immunization Practices voted just today to recommend that vaccine for people age 16 and older. Can you talk about the importance of this age specification?
Well, the age specification has to do with what was in the clinical trials. And in the clinical trials that Pfizer did, they started with age 16 and went up to about around 89 years of age, I believe, if that was the range of ages there. So when you have an approval, it's based upon what they saw in the trial. So 16 and 17-year-olds were included in the trial. There wasn't that many of them, and it was a little bit of a controversy because that's where the no and the abstention vote came from the FDA advisory committee, because there were some people who were hesitant to recommend this for 16 and 17-year-olds. But it's important to remember that 16 and 17-year-olds are not going to be in the priority groups anyway, so it's not something that they're going to get until we have much more data. And I suspect the 16 and 17-year-old, their physiology and how they react to the vaccine is not much different than how an 18-year-old reacts to it.
You know, and that just made me think of something else. I know there's been some confusion for pregnant women or women who are breastfeeding or may become pregnant as this vaccine is being distributed. What do we know about that?
Well, pregnant women were not included in this trial, but there were several women that became pregnant during the trial. They haven't delivered yet, as far as I know, but we're watching those pregnancies and seeing how they progress. There's no biological reason that this vaccine, the technology the vaccine uses, would be dangerous to a pregnant woman or to a developing fetus. However, it's unlikely that it's going to be recommended overtly for pregnant women. It may be something that pregnant women have to discuss with their doctors, and we're going to do more trials with pregnant women, with breastfeeding women, in order to know for sure how this works in that population. But again, pregnant women are at a little bit of a higher risk than the general population of the severe disease, so it's important to get data on that group.
All right, talk to us about the importance of people continuing to wear their masks, continuing to social distance, continuing to hand wash once they have received that first dose of the vaccine.
You have to remember that this vaccine, it's designed to really prevent you from having symptomatic disease or having the need to go to the hospital or to die from this. So it's not completely clear whether it provides what's called sterilizing immunity, meaning even when you're vaccinated, especially between the first and second doses, you may be somebody that can get infected, but you don't have any symptoms, and you might be contagious to others. Pfizer is going to do studies to understand whether or not this vaccine does provide that asymptomatic protection. But until we know, people are going to have to still be very mindful about not becoming asymptomatically infected. And that will still mean wearing face coverings when you can't social distance, being meticulous with hand washing, trying to stay 6 feet apart. So a lot of that's going to stay for some time until we kind of cross that herd immunity threshold or get more information about this vaccine to see if it does prevent people from becoming contagious with an asymptomatic infection.
All right, Dr. Adalja, one last question for you. We have reported on this, but I want to get your opinion on this. We do know at least 2 people in the UK did have that severe allergic reaction after they received the vaccine, although right now, obviously, the reasons for their reactions still being studied. Do you believe people with severe allergies here in the U.S. should be concerned?
I think right now, based on what happened in the United Kingdom, where 2 individuals, healthcare workers who have a history of severe allergies, prescribed EpiPens, had a severe reaction to this vaccine, I think that gives people a little bit of a pause if you're somebody that carries around an EpiPen. You likely will get guidance from CDC and FDA about how to handle that group, and it may be that we hold back on vaccinating those with a history of severe allergies or prescriptions for EpiPens until we figure out exactly what happened in the United Kingdom, trying to figure out what component Pfizer vaccine cross-reacted with their pre-existing allergy. So right now, there's not a lot of information, but I do think it's likely going to be a recommendation that those with the severe allergies who have EpiPens maybe hold back until we get some more information.
All right, Dr. Amesh Adalja, senior scholar at the Johns Hopkins Center for Health Security. Thank you so much for joining us tonight.